I'm John Miguel, a second-year BS Nursing student from the College of Health Sciences of Mindanao State University, Iligan Institute of Technology. And in this video, I am going to demonstrate how to use a partograph. So before we do that, let's first understand what a partograph is and why it is important. So a partograph is basically a visual chart that is used by either doctors, nurses, or midwives to monitor the progress of labor and to determine the condition of the mother and the baby. Now, it is important because, as I've said earlier, it monitors the progress of labor, but it can also be used to detect complications early and to ensure the safety of both the mother and the baby. So to make the partograph chart, we need to first have a complete list of the materials that we are going to need. So first, of course, is the partograph chart. Second, with writing materials such as pen or paper or pencil rather. Then we need to also have um, materials for the assessments, such as the fetal Doppler for the fetal heart rate, then the sphygmomanometer and the stethoscope for the blood pressure of the mother, and other materials in taking up assessments or vital signs of the patient. So once all of those are complete, we can now proceed in doing the partograph chart.
Hello, so going back into the discussion, what is being shown on your screen right now is an example of a partograph chart. So if we focus on it, we can kind of see that there are two segments composing it. So the first one here and the second one here. So on the first part, it indicates the progress of labor. As we can see, there is a times symbol here and numbers. So this indicates the number of hours during labor starting from hour 1 up to hour 12. That's on the x-axis. So on the y-axis, we can see numbers 4 up to 10 with centimeters symbol with the centimeter unit. It indicates the dilation of the mother's cervix. Now, on the second segment, this is called the maternal and fetal well-being. So, informations about the condition of the mother, such as vital signs are being shown here. So, looking at the upper part of this paper, we can see that there are blank portions here. So this area should be filled out first. So the information that we're going to be using to fill out this paper is from our case that was given already to us. So let's fill it out first. Okay, so this is how it looks like when all the information has been filled out. So our patient name is Jenny Kim. She is 18 years old and she was admitted on August 15, 2025 at 8 p.m. So case number is assumed to be at case number 1. So for Jenny Kim's GTPAL, so everything is 0 except for G, which is the gravida, indicating the current pregnancy. Since there are also no information given for all of these. So the fundal height also is not available since it was not given, but the fetal heartbeat is at 140 beats per minute. Admitting diagnosis was not specified, but we can put active labor for now. And the type of delivery is normal spontaneous delivery since she was not on cesarean. And the baby was delivered at 4:54 a.m. With the baby being male. And the baby weighs at 2,800 grams. So the APGAR score for it indicates the appearance or the color of the baby, the pulse or the heart rate. It also indicates the grimace, not just the reflex irritability or the baby's response to the stimulation. The A stands for activity, which is the muscle tone, and then the R is for respiration or the breathing of the baby. So a score of 8 to 9 is very normal and it indicates that the baby is in an ideal and good condition. So in using the partograph, we are going to be again basing this on the case that we have. So we are going to start filling out the progress of labor. So in the progress of labor, Jenny Kim was admitted at 8 p.m. rather, And then on the assessment at 8 p.m., she was dilated at 5 centimeters. So we are going to find 5, and then we are going to mark it using an X icon. There we go. And then we are going to write the time. So 8 p.m. 8 p.m. So on 8 p.m., Jenny Kim was assessed for the following. So she was again 5 centimeter dilated with a positive um, body of water. So we can put the amniotic fluid to be absent. Then vaginal bleeding, it was not indicated, so we can put 0. And contractions, it was indicated to be at 2 to 3 contractions every 10 minutes. And then the fetal heartbeat was recorded to be, or fetal heart rate rather, was recorded to be at 140 beats per minute. It was not mentioned that Jenny had voided, so we are going to leave that blank. Then the temperature was recorded to be at 37 degrees Celsius. Then the heart rate was recorded to be, also no heart rate was recorded at 8 p.m. for Jenny. And the blood pressure was at 110 over 80 millimeters of mercury. Then cervical dilation, again it was at 5 centimeter. And then delivery of placenta has not yet happened. Oxytocin was not yet given. And that is it for our 8 p.m. assessment. So moving on, after 4 hours, Jenny was examined again. So let's proceed with the progress of labor first. So that we are going to count 4 hours. So 1, 2, 3, 4. So and then this is our 4th hour here at 12 a.m. So at 12 a.m., Jenny Kim had or showed 7 cm in dilation. So we are going to mark it here. Then we're just gonna clean this up. Then mark the time, 12 a.m. So there we go. So upon the assessment of Jenny Kim at 12 a.m., so again, she showed a 7 centimeter in dilation. Then she voided at around 200 cc. So let's also input that here. You see? And other assessments were the same. So there were no vaginal bleeding. The amniotic fluid was absent. So contractions was not mentioned. So fetal heartbeat was 140 beats per minute. So assuming also for the contractions, since it was mentioned that everything was the same. And then the temperature is the same also at 37 degrees Celsius. Then the pulse, it was again not recorded because there were no data. Same with the blood pressure. And that is our assessment at 12 a.m. Now, after 2 hours, since the previous assessment on Jenny Kim, she was again assessed at 2 a.m. So we're gonna put 2 marking here, starting from 12 a.m. So 1, 2, and then it shows that she was 8 centimeters dilated. So we're going to put an X marking on the 8 centimeter when we are going to erase this, and then put the time. So Okay, and upon the assessment at 2 a.m., these were the information recorded. So cervical dilatation was observed at 8 centimeters. Then she had a negative bow or body of water. So it is also stated that it is a clear amniotic fluid. So we are gonna put a C marking to indicate that it is a clear, it is a clear amniotic fluid. So for vaginal bleeding, it was not mentioned, so let's put absent. Then um, next we have the fetal heart, which is at 140 beats per minute. Then other findings are the same. So for the mother's temperature, it is expected at 37 degrees Celsius. Blood pressure is the same, 110 over 80 millimeters of mercury. And then for the contractions, since again it mentioned that other assessment were the same, we're gonna put 2 to 3. So that is it for our assessment at 2 a.m. So finally, at 2:54 a.m., she gave birth to her baby. So let's indicate that at 2:54 a.m. So that's about 54 minutes after 2 a.m. And then that should be um, at 10 centimeters in dilation since the baby is out. So let's put a marking here, just about here. And then 2:54 a.m. for the time. Okay. So at 2:54, a baby boy was delivered, and then it the baby had an Apgar score of 89, which is very good again, and it's very ideal. It weighs at 2,800 grams, and then 1 unit of oxytocin was given. So let's put the marking of oxytocin. So just about here, 1 unit of oxytocin. Okay, you can do better. 1 unit, okay. 1 unit of oxytocin was given at 2:54 a.m. through IM at the mother's right deltoid. So other findings include, so for the vital signs, blood pressure is the same at 110 over 80 millimeters of mercury. Then we have the pulse rate at 98 beats per minute. Finally, there is a data for the pulse. 98 beats per minute. And then Jenny's body temperature is at 36.7 degrees Celsius. So these are all the given information at the assessment conducted after she gave birth at 2:54 a.m. Okay, so let's now focus on Jenny Kim's progress of labor. So after plotting all the dilation and the time, we can now connect all the plots. So let's use a red pen to visualize it better, starting from 8 p.m. Let's connect it to the 12 p.m. 12 a.m. rather, and then 12 a.m. to 2 a.m. and then again 2 a.m. to 2:54 a.m. Now let's mark the X because it was erased. Okay, so Jenny Kim's progress of labor actually shows an abnormal graph or an abnormal line on our graph. This is because Jenny Kim's progress of labor has went beyond our alert line. So if the progress of labor went beyond or goes beyond the alert line, it indicates that the progress of labor is going slower or is progressing slower. So this requires certain actions such as making our mother void, or it also requires careful monitoring of the mother or of the labor of the mother. Now, good thing that the labor did not went beyond our action line, because if the graph went beyond the action line, it means that intervention or medical interventions are required. So this includes transferring Jenny or the mother to a higher level facility, or introduction or in giving of oxytocin rather to the mother to induce labor, or also suggests that the mother might or needs cesarean operation for delivery. So this is now the complete partograph of Jenny Kim's labor and delivery. So siguro quick notes or disclaimers. So in writing a partograph, we do it at the hour of our assessment. So at every time we do our assessment. So as we can see here, we started at 8 p.m. and then we did this assessment. So assuming we did this assessment, so after doing the assessment, we need to put it in our partograph. So the same happens at the next IE. So at 12 a.m. like this one, 2 a.m. and then lastly at the time of delivery. So that is how we do a partograph to monitor the progress of labor and to monitor also the condition of the mother and the baby during labor and delivery. That is all, and thank you for listening.